What is the impact of blood thinners on stroke risk? Imagine a tiny clot traveling through your bloodstream, blocking an artery in your brain. That's what can cause a stroke. Blood thinners, also called anticoagulants and antiplatelet medications, help prevent these dangerous clots from forming or growing. They don't actually make your blood thinner but interfere with the process that leads to clot formation. This is especially important for people at higher risk of stroke, like those with irregular heartbeats known as atrial fibrillation. In atrial fibrillation, the heart's chaotic rhythm can cause blood to pool and form clots that might travel to the brain. Blood thinners significantly lower the chance of this happening. There are two main types of blood thinners. Anticoagulants, such as warfarin and newer drugs called direct oral anticoagulants like apixaban, work by blocking specific steps in the blood's clotting process. Antiplatelet drugs like aspirin prevent platelets from sticking together, which is another way to stop clots from forming. Studies show that anticoagulants can cut stroke risk by about 60% in people with atrial fibrillation. Newer medications like direct oral anticoagulants are just as effective as warfarin and may even reduce the risk of bleeding in some cases. Starting blood thinners early after an ischemic stroke caused by atrial fibrillation is also safe and can prevent another stroke, especially if treatment begins within days of the initial event. Of course, blood thinners are not without risks. They can cause bleeding, sometimes serious like hemorrhages. The key is finding the right balance, reducing stroke risk while minimizing bleeding chances. For some people, especially those with specific heart conditions, blood thinners might not be the best choice, and doctors will tailor treatments based on individual risk factors. For example, in certain cases, medications like aspirin might be just as effective as stronger blood thinners. In summary, blood thinners are a vital tool in preventing strokes in high-risk individuals. They work by reducing clot formation, which helps keep blood flowing smoothly to the brain. Starting treatment early can improve outcomes, but it's always important to work closely with healthcare professionals to decide the best approach. Remember, every person is different, and your doctor can help determine the safest and most effective plan for you.